Your lower back hurts. You have stretched it. You have strengthened your core. You have done planks, dead bugs, bird dogs, everything the internet tells you to do for back pain. Some of it helped for a while, but the pain keeps coming back. The same spot, the same deep ache. Here's what nobody told you. There is one muscle that is almost certainly driving your lower back pain, and it is not in any standard core strengthening program. It is not the multifidus. It is not the transverse abdominis. It is a muscle most people have never heard of, that most physiotherapists never directly address, and that after 40 becomes the single most common unrecognized source of chronic lower back pain. I'm going to show you what this muscle is, why it breaks down after 40, and the 3 specific exercises that directly fix it. Comment below. Is your lower back pain worse on one side or both sides? And if this is the kind of honest health information you have been looking for, hit subscribe. Every week I publish what your doctor does not have time to explain. The muscle is called the quadratus lumborum. Most people have never heard that name, but if you have chronic lower back pain, especially deep unilateral pain on one side, worse when you sit for long periods and when you stand up from a chair, there's a high probability this muscle is involved. The quadratus lumborum, or QL, sits deep in the lower back, on each side of the lumbar spine. It connects the bottom of the last rib to the top of the pelvis, and it runs alongside the lumbar vertebrae in between. It has 3 jobs. It stabilizes the lumbar spine from the side when you are standing or walking. It helps you bend sideways. And critically, it assists with breathing, working with the diaphragm during exhalation. Because of those 3 roles, the QL is active almost constantly. Every time you stand, it fires to hold your spine upright. Every time you walk, it fires to keep your pelvis level. Every time you breathe out, it fires. It never gets a break. Think of it like a suspension cable on a bridge, not the main structural beam, but the cable that keeps the beam from swaying sideways. The bridge can stand without it temporarily, but under load, over time, everything held by that cable starts to shift. And when the QL is tight, weak, or develop trigger points, those small hyper-irritable knots within the muscle fiber, the lumbar spine loses its lateral stability. The load distributes incorrectly. And the structures that absorb that misdirected load, the facet joints, the discs, the erector spinae, start to hurt. A 2020 study in the Journal of Pain Research found that quadratus lumborum trigger points were identified in 74% of patients with chronic non-specific lower back pain, and that direct treatment of those trigger points produced significant pain reduction in 68% of cases within 4 weeks. 74%. In most of those cases, the diagnosis had been non-specific back pain, disc issues, or muscle strain, with the QL never specifically examined. The QL does not break down randomly. After 40, 3 specific things happen that make it progressively more vulnerable. The first is asymmetric loading from prolonged sitting. When you sit, especially with any lateral lean, a crossed leg, or one side bearing more weight than the other, the QL on the loaded side is held in a shortened, compressed position for hours at a time. Over days and weeks and years of this pattern, that side develops chronic tightness and eventually trigger points. The other side, underloaded and unstimulated, loses strength. The asymmetry builds, and the lumbar spine sits in a slightly tilted position that never fully corrects. Think of it like a tent that has been set up slightly crooked for years. The ropes on one side are pulled taut, the ropes on the other side are slack. The tent stays standing, but the frame is under asymmetric stress, and eventually something tears. The second is hip flexor tightness. The iliopsoas and the QL share a functional relationship. When the hip flexors are chronically tight, the anterior pelvic tilt they produce changes the resting angle of the lumbar spine, increasing the load on the QL. The 2 muscles amplify each other's dysfunction. Tight hip flexors make the QL work harder. An overloaded QL makes pelvic alignment worse. The third is loss of lateral stability training. Core training after 40 almost universally focuses on anterior stability. Planks, crunches, dead bugs, bird dogs. These train the muscles that resist forward and backward movement. They do not train lateral stability, the resistance to sideways loading. The QL is the primary lateral stabilizer of the lumbar spine, and in most adults, it is never specifically trained. Here is a simple self-assessment for QL involvement. Stand with your feet shoulder-width apart in front of a mirror. Look at your hips. Is one hip higher than the other? Even slightly? If the right hip is higher than the left, the right QL is likely shortened and overactive. If the left hip is higher, the left QL is the problem side. Now lean sideways toward the painful side, bending your trunk to the right if the pain is on the right. If this reduces the pain or feels like relief, the QL is in a shortened position and is the driver. If leaning away from the painful side toward the left reproduces or increases the pain, that confirms QL involvement. I had a patient, Karen, 48, a project coordinator from Seattle, right-sided lower back pain for 19 months. She had completed core strengthening twice, tried yoga for 3 months, and received 2 cortisone injections. Each intervention produced temporary improvement. The pain always returned to the same location, deep, right-sided, worse after prolonged sitting, relieved briefly by walking. When I assessed her, her right hip was visibly elevated by approximately 2 centimeters. Her right QL was severely restricted on palpation. Her lateral trunk endurance on the right was significantly lower than the left. She could hold a side plank on the right for only 14 seconds before compensating. We focused entirely on the right QL, releasing the trigger points, restoring lateral mobility, and building lateral endurance symmetrically. 8 weeks later, her pain had reduced by 75%. At 12 weeks, she described herself as essentially pain-free. Same spine, same MRI, which had shown mild disc changes at L4 to L5. Completely different point of intervention. If this is starting to sound familiar, hit the like button. It helps this video reach people who have been training their core without anyone specifically addressing the muscle that stabilizes the spine from the side. 3 exercises specifically targeting the quadratus lumborum, and none of them are in standard core programs. 1 QL stretch, the lateral reach. Stand with feet shoulder width apart. Raise your right arm overhead. Reach your right arm up and over toward the left, creating a long lateral curve through the right side of your body. You should feel a deep stretch along the right side of the lower back, between the last rib and the pelvis. That is the right QL lengthening. Hold for 45 seconds. Switch sides. Do this daily. This is not a generic side stretch. The key is keeping the pelvis square. Do not let the hip shift out to the side, and reaching through the fingertips to create maximum length through the QL. A 2021 study in the Journal of Bodywork and Movement Therapies found that consistent QL stretching performed daily for 6 weeks reduced trigger point sensitivity by 52% and improved lumbar lateral flexion range by an average of 18 degrees. 2. Side-lying QL activation. Lie on your side, knees slightly bent. Keeping your pelvis level, lift your top hip directly upward, not rotating backward, just a direct lateral elevation of the hip. Hold 3 seconds. Lower slowly. This is a direct QL contraction, the muscle shortening against resistance to lift the pelvis. Repeat 12 times on each side. Most adults who try this for the first time cannot perform it correctly. The hip rotates backward instead of lifting directly upward, which shifts the work to the glutes instead of the QL. The specificity of the movement is what makes it effective. 3. Lateral endurance. The side plank with hip dip. Set up in a standard side plank, forearm on the floor, body in a straight line. Lower your hip toward the floor slowly, 3 seconds down, then raise it back to neutral. This is the eccentric and concentric loading of the QL under full lateral stability demand. Perform 8 repetitions on each side. A 2022 study in the European Spine Journal found that a 6-week protocol combining QL stretching and lateral endurance training produced a 61% reduction in chronic lower back pain, significantly outperforming standard core stability programs that did not include lateral training. 61%. From 2 exercises that target the muscle nobody told you about, the muscle nobody trains, the muscle that is active every time you stand, walk, and breathe, the muscle that breaks down asymmetrically from years of sitting and is never specifically addressed in standard back pain programs. Lateral reach stretch every day, side-lying QL activation daily, side plank with hip dip 3 times a week. Start today. If you want to know which sleeping position is compressing your quadratus lumborum every night and making it worse before you even get out of bed, that video is right here.